Hi, my name is Ron Miller. I'm a medical malpractice lawyer at Miller & Zois. My law firm handles bowel perforation cases throughout the country. Abdominal surgery involves operating near organs such as your liver, kidney, spleen, pancreas, and bowel or intestines. So anytime a surgeon enters the abdominal cavity with a sharp object like a scalpel or a trocar, they must know where they are in the patient's body to avoid inadvertently cutting or nicking the wrong organ, including the bowel. Don't cut unless you know where you're cutting. In many operations, the surgeon must cut tissue while operating inside the abdominal cavity. Sometimes the surgeon will burn bleeding vessels by using a thermal heat energy or sound waves. Any of these operating methods of cutting or burning tissue have the ability to damage surrounding organs, again, such as the bowel. In many cases, what we see is the surgeon may cut an organ even while complying with the standard of care to identify their location. Most bowel injuries are not focused on the initial injury to the bowel itself, not the cutting of the bowel, but instead the focus in the malpractice case is on the failure to diagnose the injury after it has occurred. Patients with a bowel injury present with signs and symptoms that are abnormal after surgery, and they should be readily apparent. These often include severe abdominal pain, chest pain, shortness of breath, nausea, vomiting, sweats, chills, fever, difficulty moving. There's a ton of possible symptoms. Many patients often prefer to lie down in the fetal position. That's a sign of trouble. The standard of care requires a physician to identify these signs and symptoms as soon as they occur. A delay in recognizing these signs and symptoms can lead to a patient being misdiagnosed with a minor medical condition, such as gas or heartburn, when what they're really suffering is a major medical emergency that requires immediate attention. Once suspected, a patient with a bowel perforation will usually undergo imaging. That's the play. Imaging with a CT scan, which can confirm the location and the extent and scope of the injury. The patient is then taken into emergency surgery to repair the damaged bowel. If it's caught early enough, most patients will survive with minimal or even no long-term consequences. But if it's not treated, the injured bowel will continue to leak large amounts of feces and bacteria into the abdominal cavity, which will quickly lead to sepsis, and ultimately it can lead to death. Our firm handles these kind of failure to diagnose bowel perforation cases. If you have a family member or you had a colon perforation and you think a medical malpractice may have been a contributing cause, again, my name is Ron Miller. Call me today. I'm at 800-553-8082. I'd like to talk to you about your options for pursuing a medical malpractice case. Thank you.